An explanation this evening from the Nurses Association of Jamaica over what led to several nurses leaving the vaccine Blitz site at the National Arena in St. Andrew seemingly early. As Shamela Pullen now reports, transportation was a major issue on the lockdown days.
Concerns were raised about overcrowding on lockdown days at vaccination sites across the country. The large gatherings were more than what was projected, given that only children between 12 to 18 years were being targeted for the drug. President of the Nurses Association of Jamaica, NAJ, Patsy Edwards-Henry, told TVJ News the crowd swelled after news surfaced that the FDA approved the Pfizer vaccine.
Since then, we've had scores of persons who are interested in taking the vaccine. So what we found happening is that a number of persons turned up to the different Blitz sites. Now, originally, the National Arena would not have been opened on Tuesday, but based on the numbers, the government thought it was prudent to have the National Arena opened. And the numbers that turned out was extraordinary.
The NAJ president says this affected staff, especially at the National Arena, because persons had to be turned back because many of the nurses were unable to stay. We were told most of them do not drive and there were no special arrangements to take them home.
Transportation is not provided for the staff. So what happened is that when 4 o'clock came, when a number of the persons should have left, and when transportation was available to take them, they actually left. And this included a number of the clerical staff. So what happened is that the nurses were left to do the clerical work, to write up the forms, to do everything. And that really slowed down the process. And as a result of that, a number of our clients who turned up to be vaccinated had protracted waiting times.
In the meantime, Mrs. Edwards-Henry revealed that some nurses working at Blitz sites haven't been paid.
Some nurses in St. Catherine were not paid. What I understand is that one of the persons who was responsible for payment was out sick and was having challenges, and there were a number of challenges. Just today, I received a communication about payment for Blitz workers. I was not able to look at it yet. I will go through it, but I can confidently say that there are still members of the Nurses Association who have not been paid for Blitz work done as far back as April.
Going forward, she says, dialogue will now take place to ensure these things are in place for the safety and well-being of the nurses. On Wednesday, the NAJ met with the Ministry of Health, including Health Minister Dr. Christopher Tufton, to iron out salary and other issues affecting them. Shamela Pullen, TVJ News.